Hello everyone. Our group members are Caitlin, Aaron, Vanessa Lopez, Kaylee, Jenna, and Vanessa Serratos, and today we are going to be covering Sepsis Care Bundle.
Hello everyone. We are going to be discussing sepsis. Sepsis develops when the body's response to even a simple infection spirals out of control, leading to widespread inflammation, tissue damage, and ultimately organ dysfunction. Unlike localized infections that stay put, sepsis is systemic, meaning it doesn't respect boundaries and can rapidly escalate from mild symptoms to a critical emergency. In fact, sepsis is responsible for more hospital deaths each year than heart attacks or strokes alone. It affects patients of all ages, from very young to the very elderly, which is what majority of what we saw with the patients at our clinical site, Northern. Early detection and rapid treatment are absolutely crucial, yet sepsis can often slip under the radar. Its symptoms such as fever, rapid breathing, or feeling confused can mimic many other conditions. This is why every healthcare professional, from physicians to nurses to allied staff, need to maintain a high level of suspicion and act quickly when sepsis is a possibility. Through years of research, we have now clear evidence-based protocols that guide our response when sepsis is suspected. Implementing these protocols as a team is what we call Sepsis Bundle. This has been shown to dramatically improve survival rates and patient outcomes, which is what we will be discussing in this PowerPoint. Throughout this presentation, we'll break down exactly what these sepsis bundles involve, why timing matters so much, and how interprofessional teamwork makes the difference between life and death for patients. We'll also look at recent outcome data to highlight progress and ongoing challenges. Our goal today is to discuss the tools and mindset to detect sepsis early, intervene rapidly, and work collaboratively.
Sepsis is defined as the body's systemic inflammatory response to an infection. So generally, the body's response to an infection is targeted and localized to a specific site of infection. With sepsis, the body's response to infection is not localized, and instead it causes an extreme response throughout the body. So it all begins with septicemia, which means blood poisoning. It is caused by a bacterial infection that enters the bloodstream and then later becomes sepsis if it's left untreated. So the first level of sepsis is SIRS, Systemic Inflammatory Response Syndrome. This is just the body responding to the infection, and it responds throughout the whole body, systemically. And then there's sepsis with infection, including systemic inflammatory response syndrome, in response to the infection. And the common signs and symptoms of this are fever, tachycardia, which is an increased heart rate, and tachypnea, which is an elevated respiratory rate, and also leukocytosis, which is an elevated white blood cell count. And then the next level would be severe sepsis. It is the stage where the body is coming close to organ failure or dysfunction. The common signs and symptoms are altered mental status, hypoxia, which is low oxygen, typically below 95% is what's considered abnormal. And another common sign and symptom is oliguria, which is a low urine output. And then also anuria is a common symptom. It just means it's your kidneys having a hard time producing urine and produces little to no urine. And then the most severe is septic shock. It has a very high mortality rate if it's not treated promptly. And signs and symptoms of this would be persistent hypotension. Hypotension is a low blood pressure rate, abnormally low blood pressure. And another symptom would be altered mental status, and nausea, vomiting, and diarrhea, and possibly hypothermia.
On this slide, we're looking at the key evidence-based practice components of the sepsis bundle. Sepsis is a life-threatening condition where time is absolutely critical. The sepsis bundle is designed to standardize care and improve survival by ensuring that patients receive the most effective interventions as early as possible. Let's start with the first point. Early antibiotics are a non-negotiable. Research consistently shows that every hour of delay in giving antibiotics significantly increases the patient's risk of death. This is why the sepsis bundle mandates that antibiotics be given within the first hour of recognizing sepsis. That 1 hour window can truly make the difference between recovery and mortality, which is why early recognition and immediate intervention are so essential. The second component is fluid resuscitation saves lives. Evidence from many clinical trials confirms that rapid administration of IV fluids is one of the most effective ways to treat septic patients. Fluids can reverse hypotension or low blood pressure and restore blood flow to vital organs such as the brain, heart, and kidneys. Without this intervention, organs can quickly begin to fail, leading to septic shock. So aggressive fluid resuscitation is not just recommended, it is life-saving. The third point highlights lactate as a red flag. A high lactate level is a very strong indicator of tissue hypoperfusion, meaning the tissues are not getting enough oxygenated blood. Elevated lactate can be one of the earliest warning signs of severe sepsis. By monitoring lactate and using it to guide fluid resuscitation and other treatments, clinicians can intervene earlier and improve outcomes. This is why lactate measurement is considered a critical marker in sepsis management. And finally, we have the power of the bundle. What's most important to understand is that these interventions work best when they are done together, not separately. Research shows that combined effect of antibiotics, fluid resuscitation, and lactate monitoring, implemented quickly and in coordination, has a much greater impact on survival than if each step were done in isolation. In other words, the bundle is powerful because of synergy. It attacks sepsis from multiple angles at once, which gives patients the best chance at survival.
Intercollaboration. Intercollaboration between the healthcare team is crucial in the prevention, treatment, and management of sepsis within our patients. The development of sepsis teams within the hospital is one way we can ensure our patient protection. Teams should include members like antimicrobial stewardship who ensure cleanliness of all areas where germs may come into contact with the patient, and the use of safe products when cleaning. Critical care personnel who are ready to jump in and take action in the event of our patient declines. Emergency medicine, who are the first point of contact and can spot sepsis signs and symptoms for early intervention. Hospital medicine, who is there to treat patients with sepsis and prevent worsening health. Infectious disease teams to help identify which infections we are looking at in order to treat them. Nurses, who are our primary point of contact with the patient and can treat them effectively. Pharmacy, who is on standby with antibiotics and other critical medications. Social workers for patients' families, and also to aid the patient once they are clear and ready to be discharged. We should also consider our other primary services in relation to our patient. So teams like surgery who can operate on our patient if that becomes necessary, oncology for our patients battling cancer, OB for patients who may be pregnant or postpartum, and pediatrics for when our patient might be a little one battling sepsis. Hospitals should also ensure that they have relevant support services from individuals with knowledge and training in data management and analytics for things like EHR tools for sepsis order sets that can aid in patient safety and quality improvement. Intercollaboration is crucial when it comes to sepsis intervention, and if teams do not work together, we lose our patient-centered approach.
So for patient outcomes for sepsis management, we've learned a lot about how effectively manage sepsis, and the research really drives home to the point that timing is everything. Every hour we wait to give antibiotics can increase the risk of mortality, so acting quickly is very critical. Getting those IV fluids flowing fast helps stabilize blood pressure and ensures that vital organs can get the blood they need. Monitoring lactate levels is important too. When lactate goes up, it tells us that tissues aren't getting enough oxygen, often before we see any drop in blood pressure. Catching this early allows us to step in and address the issues right away, keeping our patients safer. By combining antibiotics, IV fluids, and lactate monitoring into a coordinated plan, we're seeing some fantastic results. This approach not only saves lives, but also cuts down on how long patients need to stay in the ICU. It'll all showcase how dedicated we are to providing top quality care and keeping our patients safe and sound.
Conclusion. Sepsis is a life-threatening emergency requiring early recognition and rapid intervention. Sepsis is one of the most dangerous medical emergencies we face in the hospital setting. Unlike a simple infection that stays in one area, sepsis spreads throughout the body, overwhelming the immune system and putting every organ at risk. The longer it goes unnoticed, the higher the chance of organ failure and death are. That's why early recognition, catching the warning signs like fever, rapid breathing, increased heart rate, and sudden confusion is so important. The faster we respond, the better the chance we have of preventing serious complications. Sepsis bundle implementation improves survival, decreases complications, and shortens hospital stays. The sepsis bundle has completely changed how we approach this condition. It is a structured set of interventions backed by years of evidence that ensures patients get the right care at the right time. Research shows that when the bundle is applied consistently, patient outcomes dramatically improve. We see fewer cases of septic shock, shorter ICU stays, and overall higher survival rates. It's not just about saving lives, it's also about improving quality of care and reducing strain on healthcare systems by preventing long and complicated hospitalizations. Key practices like early antibiotics, IV fluid resuscitation, and lactate monitoring. The heart of the bundle comes down to 3 key actions. First, giving antibiotics as early as possible. Studies have shown that for every hour antibiotics are delayed, the risk of death rises. Second, IV fluid resuscitation is essential because it helps stabilize blood pressure, restore circulation, and support organ function. Without fluids, patients can quickly go into shock. And third, lactate monitoring provides critical insight into whether the body's tissues are being adequately perfused. Elevated lactate levels are a warning sign that the patient is still in danger, and they guide us in deciding whether more fluids or other interventions are needed. Together, these 3 steps are the foundation of effective sepsis care. Interprofessional collaboration is essential for successful sepsis management. Sepsis management is never a one-person job. It truly requires teamwork across the healthcare system. Physicians diagnose and order treatments. Nurses provide continuous monitoring and deliver life-saving interventions. Pharmacists ensure the correct antibiotics are available, and lab technicians run the tests that confirm infection and track lactate levels. Even respiratory therapists, social workers, and primary care teams have roles to play. When everyone works together, communication improves and delays are avoided. Interprofessional collaboration is the difference between a patient deteriorating and a patient making a full recovery. Overall, following evidence-based guidelines ensures better patient outcomes and saves lives. At the end of the day, everything comes back to evidence-based practice. The sepsis bundle is not just a checklist. It is the result of years of research and a real-world experience that show us what works. When healthcare providers consistently follow these guidelines, patients live longer, recover faster, and avoid devastating complications. Sepsis will always be a serious medical emergency, but with early recognition, rapid action, and teamwork guided by proven strategies, we can make a real difference in patient survival and quality of life.